Good morning, everybody. This is the October 23 meeting of the Maryland Lead Poisoning Prevention Commission. Want to welcome everybody to Children's Environmental Health Month, and thank you to Camille Burke for her work on children's environmental health at the state commission level. And we want to also note that this month is, in fact, National Lead Awareness Month. We will have a report on the myriad of things that are happening during this month to raise awareness. I think what I want to say is that I'm very interested in getting a couple of things done that we've been kind of harboring to get done. One is to get all of the commission members' slots filled. The second is to embark on an updated strategic plan for the commission and the state. And I've been invited, and I'll talk with MDE, but I was invited to present to both the judicial proceedings and the environment and transportation committees in the legislature. And I want to make sure that we're all collectively able to do that at the beginning of January. But most of all, what is on my mind, and I hope is on the minds of many here, is that we cannot rest on great success that we have in Maryland in terms of our legislation and the work that has been done. We remain one of the lower funded states on lead hazard control, lead abatement work, and while we have really good standards and practices, we have a challenge coming out of COVID across agencies and across the landscape with a state of what appears to be a spike in lead levels coming in at high levels. And I think is a wake-up call for us to make sure that we follow through on what we talked about last meeting, which is better interagency coordination, better support to get what we need in state and local governments to get earlier, more proactive responses, and to up the inspection and compliance standards as they're moving forward. I want to just thank all the people at MDE and the city and other agencies that are working to address these cases and trying to step forward. I also want to thank my staff and especially the staff of the Mount Washington Pediatric Hospital. I think our goal is that we can move to where we won't have the need of the Mount Washington Pediatric Hospital for chelating children, and love Barbara Moore in the hospital and celebrating its 100th year this year, but we want to put that clinic out of business, so to speak. And we need to work a little harder, I think, to do that. The other thing I want to just make everyone really aware is as we look at the dollars that are coming into the state for things including solar and greenhouse gas emissions, in all of those applications, national and local applications, there's a couple of points of deep interest, right, to this commission. One is the environmental justice and equity work that needs to be done there and should be done. But the other is the opportunity that this funding affords for removal of lead in exposure in housing. There will be, coming out of the $20 billion of greenhouse gas proposals, there is money available to do pre-development work and pre-retrofit work to address the issues of lead and mold, mildew, moisture, leaky roofs. And we are encouraging the applications in the state and those who are going on the national work to pay attention to that. In the state of Maryland, the Calvert Foundation is leading one of the leading proposals there, but the Coalition for Green Capital and Justice Climate all are adding in, an Opportunity Finance Network, and all of them are adding in the effort to address lead. And I hope that we will be able, once those applications are in, to bring those applicants forward to the commission so we can understand what may be a promising pathway there. And that will include, in our efforts on that, will also include money for childcare, which I still think is a majorly underfunded aspect of the lead work. But I did want to say that, I think, do need to get our strategic plan moving forward. We've got to finish the work on linking the MHIC and funding for childcare, and get an update on how this is working also with the lead and water issues. Before I do start the agenda, Paula, there was a question that was put over to you this morning, and you may want to give an update during the agenda, but just in the status of the annual report and when it will be out. So just know that's been getting asked of GHHI, and we forwarded that question over today. But if we can, Wendy, I'm going to do a quick roll call for the commissioners, and then we'll adopt the minutes and get to the agenda. And I want to thank everybody for joining us this morning. So, Mangela, let's start with you.
Good morning. Mangela Paul from Office of Child Care at Maryland State Department of Education as the commission member. Thank you.
Great. Anna?
Hi, Anna Davis, commission member.
Fantastic. Barbara Moore?
Barbara's on vacation.
Barbara Moore.
There she is.
The director of the lead poisoning program at Mount Washington Pediatric Hospital, commission member.
And on vacation calling in. Thank you very much, Barbara. Appreciate the dedication on that and your stellar work that we've seen with these cases coming in. So thank you. Benita Cooper.
Good morning, Benita Cooper with the Maryland Insurance Administration, commission member.
It's been good to see you. Is anybody representing on the commission the city of Baltimore this morning? I think Nicole is out. Is Catherine on? Neil, thank you for being here. I know Dr. Mitchell is out. Welcome to Candace Scott, who's here, I see. Christina, you want to introduce yourself?
Christina Bush, Executive Director of the Maryland State Child Care Association, Commissioner.
Great, thank you. Representing MDE?
Paula Montgomery. Good morning, everyone.
Thank you, Paula. Jack Daniels?
Jack Daniels, commission member, Maryland Department of Housing and Community Development.
Okay, we got Mangela.
Susan Kleinhammer's on.
Yep, I'm down to Susan.
Good morning, everybody. Susan Kleinhammer, Lead Tech Services commission member.
I think Adam is Adam on?
I don't see him on. And then Cliff is going to be late. Mary Beth and Paul. Well, Dr. Rogers is not coming. And then Mary Beth has,
Mary Beth is no longer the representative, right?
Right, yep.
So Nicole Hart is out. Cliff Mitchell will join. Paul Rogers is out. And
Jacob Benzikin I have not heard from, and I don't see him on.
Okay. Do we have quorum?
Yes.
Okay, thank you. If everyone has read minutes of the last meeting, Wendy, if you want to put the agenda up or the minutes as you see fit, I just want to, do we have a motion to adopt the minutes from the last meeting?
Okay. Share attendance. Is that it? No. I'm trying to get it up here, people. Hold on.
That's okay. If we've all read the minutes, if somebody wants to make a motion to adopt the minutes.
I'll make a motion
Thank
This
you,
is Paul.
Paula. Can I get a second?
And I'll second. and
Thank you,
Anna.
Anna. Thank you. And all in favor?
Aye.
Aye.
Okay. Any opposed? Wendy, I want to note for the record that once again, we don't have the members of the legislature appointed, and I'm asking that we have if you could provide the attendance record on that so that I can work with Secretary McElwain's office to see if we can't get those appointed who I know I spoke to Delegate Batson who has interest in this issue, so I think she's going to be willing to stand in if we don't have a member from the House going. I'd like to see, and I also spoke to Senator Will Smith about seeing if we could get somebody from judicial proceedings on the Senate side, because that's where legislation goes. I think we'll be able to get that addressed, and certainly would ask commission members or for any other recommendations on how we might address that. I know, Wendy, we have the annual meeting of annual awards during this month of commission awards and recognition and announcement. Only you hold the answers to that, so we're going to turn that over to you and let you see where we are on that.
Okay, do you want to just go briefly through the commission membership renewals to give a status?
If you have the chart,
Yes,
we can
I
do
do.
that.
I do. Here it is. Okay, so as an FYI, excuse me. So Jack Daniels, I'm not sure if you were included in that email or not, but Chuck Cook, legislative officer from DHCD, indicated that the secretary would like to appoint Theo Williams, who has applied. Don't have an answer yet back from the governor's office.
Okay.
But
And who is Mr. Williams? And this would replace Jack Daniels?
Correct. And I'm not sure, I don't have all the information on Mr. Williams. I will try to get that.
Jack, can you tell us who Theo Williams is, please?
He works in the office of the secretary. I believe he's one of Secretary Day's policy analysts, but I actually have never met him. So I'll get more information in a bio and I'll send it out to the group.
Thank you, sir. Appreciate that. Sorry that we will lose your tenure when that happens, and thank you for all that you do. All right, Wendy.
Benita, yes, Benita, what's your status? Were you able to apply? Because I hadn't heard anything back from you.
No, I have not applied as of yet. I will do that on next week.
Okay.
Thank you, Benita.
I sent out the email. Let me know if you need me to send it to you again. It has the link on that for the application link. So Jacob and then Barbara Moore and Anna Davis all responded that they did apply, but again, we're waiting on word whether or not it's all confirmed and approved and all. And then Nicole Hart, I believe, has also applied, and again, still waiting from governor's office. So we don't have any confirmed, we don't have any confirmation on that everybody has been reappointed, but it's in the works going on.
I will, Tyler, are you following up with, or who's following up with Secretary Edwards, or I'm happy to do so?
Gabby is the one I've been contacting. We've both been trying to contact the governor's office. So she's on that and trying to keep in touch with them on a regular basis to try to get status updates, but that's all we know.
And Gabby works in the Secretary Edwards office?
No, she's with our secretary's office.
Oh, with your secretary's office. Okay. All right. Thank you so much. That's any other questions? I know Barbara, you and I and others can talk about pursuing some parents to serve on the commission and trying to get them to do the final application. Yes, Barbara.
We had a parent that was interested, and I thought she was going to receive information on how to apply.
She
But I'm
did.
not- Yeah. Oh, she did. Okay. So is hers in process or it was declined?
I don't know where it stands, but we will follow up with her and we can follow up offline to see where that is and see if there's any additional help needed or if the secretary's office has it and where it needs to go from there.
Okay. Thank you.
All righty. And if there are other parents that people want to refer that are, please do. And the one question I have, and maybe Chris Corzine can answer this, we are happy to provide funding to support any time that may be needed to support for a parent to take off work or otherwise. And I don't know, I recall there was some ability to support transportation, I think, to the commission, but more and more, I think an equitable measure is to ensure that if we are supporting people so they can take the time off from their jobs, if need be, to participate. And Camille, I'm not sure how you handle that on any of the commissions you're on, if there's any, if that's happening, but I know working across the country in many of these committees that we are more and more supporting that time and effort. So I don't know, but I'd like to at least pose the question to council at MDE if we can do that.
Okay, so if nobody else has any comments or questions,
I'm just asking if MDE will take up that question.
Oh,
But I can certainly consult with Chris Corzine and see what the,
Yeah, Chris is on the phone too, I see. So
Yeah.
it'd be helpful. Chris, if you could just acknowledge the question.
Hey, Ruth Ann, I'm sorry, I was in somebody's office. What's the question?
So whether or not we can stipend parent members of the commission for their time.
I would have no idea. I'd have to look that up.
Okay, thank you.
Sure.
Okay, thank you. All right. So thank you. We will continue to pursue that. So you want to go to the MDE awards? Paul, is this for you or Wendy? The lead commission awards, because I don't know the results of that, and I think you all have that.
yep. So what we have, just for everybody or those that do not know, so yearly, the Lead Poisoning Prevention Commission aims to recognize excellence, innovation, and leadership from within the lead poisoning prevention community. So candidates in the below listed categories on the screen are nominated for any of the 3 awards also listed below.
There's nothing on the screen.
Oh, there's nothing on the screen?
Well, there's the
Oh.
agenda. The agenda's
Oh,
on the screen.
Okay, let me try this again. Sorry about that, guys.
There's Paula. I can
Share.
see Paula.
what's
Okay.
that?
You just want to read.
Yes,
Oh, I
I
guess
was,
she's.
Can you
So-
see this? Can you see this
Yeah.
now, guys? Okay.
the write-ups, Wendy, and we'll be all right.
Okay, so yeah, let me pull that up then. Hold on.
Yeah, just give me the write-ups.
Sorry, guys, we'll move, the virtual world is not so easy, and then we'll move into the other work. Go ahead, Paula, this is your show.
Yes.
And is Tyler serving as the people who hand you the big Oscar when very?
I'm gonna hand it to Tyler. I'm just gonna virtually hand this to people.
Hand it through the camera.
Right. So,
Oh, here we go.
every year, for those of you who are not familiar with this, we get three people that are we see as champions in the lead poisoning prevention world, and we've been doing this for 3 years. So what we do is we ask the commissioners for nominations based on criteria established several years ago. And then the commissioners make recommendations, and then we vote on the specific categories and then come up with the candidates. So there's 3 separate categories for which we vote on. As you can see, the first one is going to be awarded to Outstanding Child Health Environmental Advocate, is presented to Mangela Paul for the Office of Child Care. I don't even know what the write-up is on Mangela, but I'm going to tell you what it is. Mangela is, first of all, she's one of the kindest colleagues that I've ever had the pleasure of working with in the last 10 years. And she is always willing to lend a hand regarding the child care's involvement in lead poisoning prevention. She, other things that she do that a lot of people don't realize, there's a lot of emails behind the scenes, and Mangela in particular is very on top. The licensed facilities that are under the Department of Child Care. And it's because of her that there were rules implemented for lead poisoning prevention solely, and she single-handedly made sure that that was implemented. And I can tell you that it was a very nerve-wracking process, to say, over the years, because we had to do a lot of training, and we're going to continue to do that training through the years to make sure that children, when they go to child cares, that they're safe not only from from all environmental hazards, but in particular lead. So again, I would like to shake Mangela's hand and congratulate her. Man, would you like to say anything?
Well, Paula, just hang tight. I just want to add my congratulations on behalf of the entire commission for just an amazing partner and an amazing advocate for both children and caretakers and thoughtfulness. Congratulations, Mangela. Now, there you go. Mangela, you want to speak?
Thank you, Paula, and thank you, Ms. Ruthen, and thank you, commission members and everyone. I'm really honored as well, humbled to receive this award. I know it's not the responsibility alone, it's a burden and passion to ensure that these young children come into our programs, especially like whether it's a federally funded program or state funded programs. And we have the responsibility to ensure that these children are cared in a healthy and safe environment so that the age appropriate development, growth, and learning takes place, and to help them to be successful in their lives. And so this is my aim, my passion, and you all in different capacities, you all work towards this to enable to see children are prevented from this poisonous exposures, and so that whatever it may be, and you are there, and we make sure that we implement it and we promote enrollment into the child care program so that no children is left at home for whatever reason, whether it's a chronic condition or whether it's the economic condition, or it's a parent's hesitance to be keeping their children home because of their whatever is happening with their children. So we promote that. We bring those children into our programs, and we ensure that the children at various levels, the lead exposure is prevented. and immediately identified, and also they are being tested. I'm so happy that I'm in this position to help these young children and to see them succeed. So when we are as Marylanders are proud of our kids, whatever ages they are, and we take pride. And when they fail, and we just go back and reflect, like in our personal life, in our professional life, and in our positions, how we could have improved our systems to protect these children.
Amen.
So I take it as my personal responsibility and professional responsibility. I'm happy to be in this position. And Paula well said, it's a huge responsibility, a lot of tasks behind the scenes at various levels to make sure that these children are being protected. But I'm happy that I'm in this position to do this for our welfare of our children. So thank you for the award and honoring me and acknowledging the work. Thank you.
Way to go. Congratulations, Angela. Not a better person. Thank you. And it just reminds me, I'd love it if you would in the next couple of months really give us a really full brief on those things that we could maximize in the work. I know you have a voice every meeting, but a real update for the public on how childcare is working to help prevent lead poisoning would be great. If you'll agree to do that, I'd love to have you really lift that up, and also what we need from the public to make that better. So that'd be wonderful. Thank you so much for your work. Paula, do you have more?
I have, yes, hi.
Hey, Paula.
I would like, if Letitia, is Letitia on the line?
Wendy, what were you going to say?
Sorry.
Paula can hear me?
Yes.
Yeah, I did find that right up. Do you want me to quickly just read Mangela's, or do you want to just go on to Lakeisha?
Let's go on Letitia's.
Okay. Yep.
Let's see, Letitia, are you up there on the line?
She was earlier. Let me look and see.
She is not on the line.
She is not on. She was earlier.
Unless she's on by phone.
Oh, yes, we do have one caller on who is,
Okay.
Yeah.
Fine, let's just go through it. So the next award is going to be for an outstanding advocate award. And this award is presented to Letitia White of Maryland Department of the Environment. So Wendy, if you could just let everyone know why she was recommended.
Yeah, give me 1 second. All right, Mangela, so Letitia. Okay, here we go. So Letitia is a staff member for the lead rental registration section of MDE's lead poisoning prevention program. She's been with the department for 18 years. And in addition to her duties during work hours, she's become an integral part of MDE's outreach team. She always makes herself available to the lead program and Office of Communications. She has a true passion for making our children safe from lead exposure.
Yay!
Yay! Oh, she's on now, Letitia. I think she's muted though. I see her on. There she goes.
Oh my God. Oh my God. Thank you guys. Oh my God. You guys are going to make me cry. Oh my God.
That was the entire intent, was to make you cry.
Oh my God. I'm so excited. Thank you guys. Oh. I don't know what to say. I'm just, thank you guys for recognizing all the hard work that I did for all these years. And I just so appreciate you guys so much. Thank you.
Letitia,
Thank you.
Letitia, you don't have an easy job handling that rental registry, and I know that that's a really big task. It's the crux on which we can build certifications and really make plans and do things from enforcement to education. How amazing your public service is in that, and how much it is appreciated by the entire commission. And we thank you for your hard work. And I want only tears of joy, because I'm sure some of the hard work sometimes maybe causes other tears. And we just want you to feel lifted up and acknowledged and really appreciated. And thank you so much for your service at the Maryland Department of the Environment.
You're very welcome. Thank you all again.
And we're gonna make you do a like a little bit on the rental the day in the life of trying to run a rental registry someday. That'll be an interesting thing. Right?
Oh my God.
It's a lot. Let's keep doing it. It's
Yeah.
really important. I know everybody needs that info, and so thank you so much. And I'm sure you do a lot of education with people in the midst of that, so appreciate that. Okay,
All right,
Ms.
thank you
Paula,
very much.
as we move on, are we?
So we have one more award. Paula, are you there?
I'm here.
So, yeah, I'm going to introduce this one.
Award to me.
This, let me pull up the award here.
Tyler's doing it.
Oh, yeah. Okay, great. Tyler, go ahead. So this is the Special Recognition Award, and it is being presented from Tyler to Paula. So congratulations, Paula.
Thank you very much.
Thank you for your work. And I appreciate all the additional outreach and education that's happening right now. I think that we've revitalized the program that we've been having here, and I know there's more work to come and good work to continue. So appreciate what you're doing.
So Paula provides constant support to the commission and to the departments to enable policy and regulation development and other related resources. And she has personally helped me tremendously when I, first coming in to staff the SLED Commission, not knowing anything about it. She has been such a help and support. So thank you so much, Paula, for all that you've done and how you've worked with me and all your support and all the work that you do for the commission. We all truly appreciate that. You are invaluable.
I think
you
it
are valuable.
Goes well beyond the commission to the program that serves the public. And Paul, I'm one of the few people on the line who remember you as a young person at the Baltimore City Health Department when you were over on that little street in Federal Hills somewhere. I can't remember what it was called, and buried in the basement, right in that job. And look at all the amazing work you've done and over what has to be 30, 35 plus years of work in this issue, and still going strong on it. Amazing show of public dedication to excellence, and we appreciate that. And as I said, I think only maybe Wes Stewart and I are old enough to remember you when you were. And what was your name before you got married?
Paula Veltri.
Veltri, there you go. That's how we knew you, right? So anyhow.
I'm getting ready to Paula Veltri again.
Oh, there you go. Okay, well, life
Not
cycle.
Right, yeah.
Well, we very much appreciate your constancy, your consistency, and your commitment, and so well deserved. So thank you. Cheers.
Cheers.
Yay.
Thank you, everyone. Okay, moving on.
Yep, let's move to the agenda here. Congratulations to all of the recognition provided to our state employees and staff and leaders. Appreciate all your great work. It is upcoming lead poisoning prevention week that is coming up, and I know there's a myriad of activities that are being planned between the Maryland Department of the Environment, the Department of Health, Housing and Community Development, and groups across the state. I think I saw Val Bash and Candace Scott on the phone, and I'll ask that they could maybe lead with whoever the MDE rep is to go over the events of the Awareness Week. And as I said, I hope that we'll use this National Lead Poisoning Prevention Awareness Week to help us remember for all of our success, and that which needs to get recognized. We have an awful lot to do to be much more on the front lines of prevention. So Chevelle, are you on? And maybe you could help and lift up what's happening. And Wendy, I don't know if you have a list of the events.
I
or
do not have a list.
If Chevelle could share her screen, perhaps, or Wes would share the screen with the events. Chevelle, are you on?
Yes, I am. I was talking, but y'all couldn't hear me. Sorry.
Okay. Do you have a list
Yeah.
of events that you can share that could be shown?
Let me see. Let me share my screen. I do have a list of events. Can y'all see it?
Not yet.
There we go.
There you
Yeah.
go. It's coming.
Okay.
If you can increase that, I don't know how we can increase the size there, but why don't you go ahead and Chevelle, can you acknowledge all the partners that are involved in this too? Because I know there's been ongoing planning meetings.
Yes, there's been several planning meetings. Myself and Candace from MDH. We done had MDE on the line, as well as Department of Housing and Community Development. We've been working with Baltimore City Health Department Lab Program. Camille has been on our calls so that we can coordinate several events that will be going on throughout the week. And we will be having a series of social media campaigns that's going to be launched that have already started. Matter of fact, from the GHHI side to bring awareness for Lead Poison Awareness Week. To kick it off, we're going to be doing a press conference at CCI Health Services in Greenbelt from 11 to 12. And immediately following that, we're just waiting on final confirmation. We will be doing a presentation at one of the Greenbelt Head Starts as well to talk to the children about lead poison awareness. Then we have clinic days scheduled at the FQHCs. At Total Healthcare, we're going to be doing a presentation as well as setting up a resource table to share the importance of getting their children tested for lead. We also have a parent lead awareness and prevention resource workshop that will be taking place at North Bend Elementary Middle School, and that's going to take place on that Tuesday, the 24th. Wednesday, we have the Lead and Healthy Homes workshop that is scheduled at Baltimore City Community College, and that's being sponsored by Baltimore City Health Department's lab program. That's Camille's team, and Candace and I have been assisting with the planning and logistics of this event as well. On Thursday, the 26th, we are planning to do a pop-up resource fair at Lexington Market. This is tentative. We're just waiting on final confirmation, as well as another event at the Washington Boulevard location at Total Healthcare that will be taking place. And we are providing later on the afternoon property owner training that will be finalized by tomorrow.
Is the property owner training going to be virtual or in person?
It's going to be virtual.
Okay.
Yes. And
let's make sure that we reach out to Adam Skolnick and Jacob, who may not be here today, but make sure we invite them to join in that. I know they and Susan Kleinhammer, who's on the phone here as well from the commission.
Okay. Yep, I will definitely do that. And then we will be at another elementary school doing a presentation with the kids doing storytelling on lead poison awareness. So we will be educating both the kids and the teachers that will be at the school, and that's going to be from 10 to 12. And then Saturday, we will be participating in Zubul. This is the most popular event. It takes place on Saturday and Sunday from 10 to 4, and we'll be there giving out information as well as talking to the kids and the parents about testing measures and lead poisoning.
Let me also just invite our agencies who have grant programs for which they want to get connection to families and applications. If you want to have a person at these events or have other events, we really strongly encourage that. Or if you want our staff to provide information for you if you can't be at any of these events. And this and it's not only this week that I know all these organizations coming together are doing work. The Black Millennials for Flint will be doing some work in Maryland during Lead Week, and we'll share that. A number of groups working on lead. We will share that up on the GHHI website and send that out to the commission. Angela, it'd be great if we had a child care event or something that we could do to lift up child care during that week. And certainly we'll want to do as many property owner trainings as we can. But throughout the weeks and the months, we're doing lots of events. This coming Saturday, we're kicking off part of the work on this awareness month of Children's Environmental Health and Lead Awareness Month. We're going to be at the Baltimore City Trolley Tour. And we're going to go and really support them because little did they know the Orioles and the big concerts would be happening on the same day. But this is for new homeowners to do that. And I want to just say to everybody on the phone, if there is an opportunity throughout the state, from the Western Maryland to the Eastern Shore, to invite us in or to share what it may be happening in clinics, civic association or churches or other associations, we want to be there in strong support through the many programs of MDH, MDE, DHCD, and GHHI, and many community partners. We're going to be sending a letter out about 1,000 nonprofits in Maryland in the next couple of days, just giving some toolkit information and information on how they can lift up and participate every day on this. I wanted to get Tyler or Paula, do you know if you all are going to be engaging the governor for a proclamation for the month, for the awareness week?
It is in process.
Great. And I hope Camille for Baltimore City, do you know who's handling that?
I can ask. It probably would and should have been me, but I will make the request.
Okay, we're happy to help. And then we're going to request this of all of the county executives as well. I know County Executive also Brooks has been pretty active in Prince George's County and the county executive in Montgomery. So we will certainly be asking of all of those groups. And I'm hopeful that from when you have agency meetings or association meetings, you're raising this in all of your talks. Yes, ma'am, Ms. Burke.
Oh, that was me. That was Chevelle.
Oh, Chevelle, I'm sorry.
Yes, I just also wanted to add that we are planning an event with Aetna Health. We will be doing an actual lead screening event at Mondawmin Mall on November the 11th from 11 to 3, I believe the time is, and that would Total Health Care is in Mondawmin Mall, and they will be actually screening children. Some of Aetna Health non-compliant clients that are in need of those lead screening testings done. So we will be actually doing testing on November the 11th at Mondawmin Mall.
Great. And again, if you have events that you would like to see done, please call on us at any time, not just now, but throughout the year. Paula, do you want to say anything for MDE or the MDE team?
Thank you. So we've been, as everyone may or may not know, we meet weekly with all of our state partners and GHHI to, discuss what is going on during Lead Week, which I might say that I think it may be a good idea to continue these meetings, at least on a quarterly basis, because I think there's some really, really good coordination that's going on, in particular for outreach and education. For Lead Week in particular, the department has the lead paint abatement service provider. As you all may be aware, Maryland regulates approximately 4,000 lead paint service providers, contractors and inspectors, third-party contractors and inspectors that perform lead services in Maryland. Also, outside of Lead Week, we're also going to be doing one of those forums on the Eastern Shore. I believe that's the 19th of October. And then we have one at Warwick Community College. And then we have one in the first part of November at Hagerstown Community College. We're also doing...
Paula, make sure that we'll get that out into our constant contacts and newsletter push as well. If you're looking for connections there, that's great. And have our communications team work with you all to get anything out on those trainings.
Yeah, we obviously have a list of all training providers in the state. So we were able to get that email out and then work with our Office of Communications on that. We're also doing a little myriad of outreach events throughout September and October, and I'd be happy to share those with the commission. Health departments to get to some health fairs and stuff like that. So that's where Letitia has been incredibly supportive to the department. She's amazing to do outreach with. So I'm happy to have her. So that's it for MDE. Anything else?
Dr. Mitchell, I saw you join, and I know Candace has been doing an outstanding job of helping to coordinate these meetings. I think the idea of having a quarterly coordination on communications, education, outreach, and training would be a good idea. And Candace and Chevelle, certainly second Paula's, maybe I've amended Paula's suggestion there, but I think it's a great idea. But Dr. Mitchell, welcome to the meeting. Do you have any, we're talking about Lead Week, anything you'd like to add?
No, except to say that, first of all, the reason it's going so well is because Candace and Chevelle have been doing such a terrific job. And I really do want to say I agree completely. This is the last year or so following COVID. We obviously knew that we were going to be doing a lot of catch up with a lot of families across the state, partially because of all the health departments sort of coming out from the fog of COVID, and a lot of the agencies coming out of the fog of COVID, and a lot of families, frankly, coming out of the fog of COVID. But what's been really heartening is people have jumped right back in. And I think that the increased focus and attention on health equity and disparities, and making sure that we are identifying the kids who are most at risk, and using our resources as effectively as possible. One of the things, I don't know if Candace mentioned or not, Candace, did you talk about the Rocky Project at all?
No, I didn't, Dr. Mitchell.
So just a little background, we at the health department have been looking at our own programs from the point of view of health equity, and trying to assess whether we're delivering services in an equitable way, and whether or not we are trying to address specific disparities, which we know exist across all of our health department services. So we did that with our home visiting program for asthma last year. This year, we're looking at our lead program, specifically at the lead home visiting program, and the work we do with respect to the the Environmental Health Bureau does with respect to the lead abatement program that is commonly known as Healthy Homes for Healthy Kids. That's not the same thing as saying we're looking at the DHCD part of this. That's a different question, but we just want to make sure in terms of reaching kids who are most at risk, making sure that wherever we can, we get those applications and work with them so that they can get lead abatement services. This is something we're trying to do And I think it's very much going to be a focus of what we do moving forward, is to try to keep that attention on that issue.
I agree, and we ought to talk more about what we can do to really have the public understand what health equity is, and the roles that we all play in that, and how we measure it, how we report it out. And I want to thank you and Candace and Shubha and the entire team for staying on this. Are there other partners in this work for the week? We look forward to it. I want it to be an everyday occasion and event in this. If there's anybody else who would like to add, otherwise, Chevelle, I'll have you close that out. And only to say that Derek the Dinosaur, who is our mascot, will also be making an appearance for lead prevention at the Great Lantern Parade in Patterson Park, wearing the costume for Derek.
Yeah.
That's not the Great Lantern Fly Parade, right?
No, it's the Halloween parade, but we're going to just make sure we go to every audience possible. So, Cheryl, anything else you want to raise here?
Nope, that was it. That was all the activities that we
Appreciate
had
all
thus
of the
far.
work for everybody there. All right, Wendy, what is next on our agenda, please?
I forgot I was muted. Sorry, guys. So I just pulled the agenda up. If we are all done discussing the Lead, Poison, and Prevention Week, the next topic is the agency hot topics current events. Unless you wanted, you had anything else you wanted to add in there, Ruth Ann.
Nope, I think we are good, and we'll move along here. I know we've asked for some updates that will get moved, but let's, MDE, do you have further updates?
I have nothing. Go ahead, Tyler.
Nope. Fred, you got anything? Fred, you here?
Yeah, not here. Nope, we don't have anything.
Do we know, Tyler, where we stand on the annual report coming out, when that's going to be moving forward? And also, it would be good to get an update on enforcement actions by the state, and when we might be able to get some update on enforcement actions that are coming out of the state.
Fred?
So the annual report for 2022 should be completed by the end of this month, and then we're aiming to have 2023 completed by February, mid-February of next year. So we're trying to get caught up on some of those data issues that we had, and we had a big migration from one platform to the next. So we had some report issues, but I think we got them all ironed out, and we should have, like I said, the 2022 report done by the end of October, and then 2023 should be ready by mid-February. And I can ask John to do an enforcement report maybe in the next meeting, or I can send something out to you guys to look at electronically, and then if there are any questions, we can address it in the next meeting if that works.
Okay, and just one of the questions I have is any support or barriers that the enforcement side on the state needs, whether it's regulatory, legislative, or funding, would be good to know, and what would make that process better. And Paul, I've also gotten questions around the timeliness of lab reports going, and I don't know, I'm sure you're tracking that, and if there's any issues there that you wanted to raise about that. And maybe want to think about, or Dr. Ross, Oss, yes, ma'am.
A special good morning to everyone.
Good morning.
Most definitely in regard to your last comment, there has been continuing conversations and discussions, including with our Office of Attorney General, in regard to our continued issues and potential real barriers related to our lab reporting compliance. Basically, to say what has happened there has been an audit within the surveillance section of our public health laboratory services that was updated to the revised regulations that were effective as of July 1st, 2020. This particular regulation is intended to ensure that the practice of our labs are fully compliant. This is COMAR 26.02.01. This is the blood lead reporting for healthcare providers as well as the laboratories. So what information is involved? The information that continues to demonstrate non-compliance to a very large degree among our corporate laboratories and some selected medical health providers relates to the blood lead reporting requirements that are related to, number one, if a child is a female, whether that child was pregnant at the time of the blood lead level. In most recent, and I would say over the past 3 months or 90 days, we have had an increase in the number of individuals that are being reported as pregnant with children who also have elevated blood levels. However, the lab report is identifying them as adults, but not as pregnant. Therefore, it is difficult to be able to differentiate whether or not these particular blood lead levels for reporting purposes are representing that particular subgroup of the population that is a requirement for maternal child health. The other areas that are causing our most distress is that of reporting of guardian. We cannot implement effective case management if we do not have the name reported of the guardian. We recognize that the children are unable to talk and communicate because we are looking at these lab results of children that is under the age of 6, and with the most volume, of course, being those between the 12-month and the 24-month. Without a guardian name, contact information, address, and phone number, this becomes a very difficult task for tracking and detection. The next level, of course, will always be and remain the actual address of the resident where the child and the guardian currently resides. And the final area, of course, is in fact having an impact on the reports for our partners, including the governor's office, when we get PIAs that is specifically related to the environmental justice requirements, as well as looking at health disparities, race, and violence. So if the race or the ethnicity is not included, all of these factors influence our current operations within our new modernization of data surveillance by using the HELP system. This system does not allow the input of data that is incomplete, that is purposeful on behalf of CDC. The mandate is for the information that we receive from the public health laboratory services to be complete as possible. Our task becomes making contact with individual labs, as well as individual providers and individual managed care organizations. And as we know, there's a diversified, totally new update of providers because people retire and people are added to the roles consistently of healthcare providers. It is the provider that orders the lead test. Therefore, education, as I have mentioned before, becomes a primary focus in regard to reviewing the essential functions as it relates to the laboratories, number one, to ensure the compliance of their clients, who is the medical providers. And the medical providers must ensure the compliance of their administration and office managers, who indeed provides the actual requisitions with the required information. We are being advised that they do not receive the information.
Doctor, I really appreciate this input, and I'm trying to figure out how we can best address all of it. And I appreciate the need for data around the equity and environmental justice tracking. But perhaps we can work offline to sort of formulate a set of recommendations or work on this, because this is so critically important. And I'm only looking at the time. I'm on Central Time. So Wendy, I think we're coming close to time. And I think this is so important. It deserves a deeper look. Barbara?
Okay, so just real quick, considering all that, and it's only 10:34.
Oh, okay. I'm sorry. Thank you. Okay, we got plenty of time. Let's go.
However, considering this, I presented at Grand Rounds over at Mercy on Friday, and one of the questions that came up from them, from their primary care team, as well as we run into all the time, is the address that the parent gives when they register at a facility, like come into clinic and they are registered, and that is what is on the lab slip. Frequently, it's not where they're actually living. This is where they receive all of their mail. It's grandma's house, it's aunt's house, it's somebody else's house. So that frequently is on all of their information. And then when talking to them, you find out that's not really where they live. They might go there, but they don't live there. So that's the one issue. The other, if LabCorp and Quest, they have specific questions. When you have an electronic medical record system, whether it's in a primary care office or a hospital-based clinic, there's an interface between the electronic medical record system the facility uses and LabCorp or Quest. And there's specific queries that are in the order. Currently, there is not a query about pregnancy, at least not on the LabCorp side. So that might be something to consider, asking them to add that query, because it wouldn't be hard for people to just click yes or no. So it's a reminder for the providers.
Okay, thank you. Any other comments on this? And Doctor, did you have anything else you wanted to add in the wrap up of your input on this? Because I think this is important and something we'll take up.
I will say that our primary labs that we are working with and have received communication from, that they are also attempting to find solutions, because the replies that they get for state reporting from their clients is that they do not have the data. Therefore, as long as they notify us that this is their reply, then we must take it to another level. But it does include LabCorp. It does include Quest. It does include BioReference. And as I said, I have a list of private or community health providers that we are consistently trying to address the issues with. But at this particular time, we do not have that solution in order to ensure that the registry will in fact be able to record all children and pregnant women in the state of Maryland, that this information continues to be in non-compliance.
Okay. Thank you so much. Any other comments on that? Because I think there's actions here and improvements needed, certainly. Any other comments? Thank you. Anything else from MDE? I can't read the note there that's coming up. Anything else from MDE?
Not here.
Thank you. Cliff.
Well, I mentioned the root causes of health inequity analysis that we're doing of our lead program. We are also, there are a couple of really exciting things that are happening. One is we've been working with the Johns Hopkins Preventive Medicine Residency Program in the Baltimore City Health Department on a detailing project. Dr. Emmanuel Asenso, who was here last time, and we have a new preventive medicine resident who's going to be working on this also, are working on, they're working on a physician detailing outreach program where they would visit physician offices and talk about our home visiting program, lead testing, and the associated services on lead abatement offered through DHCD and the Children's Health Insurance Program. The goal of this is for physicians, the residents, to physically go into healthcare provider offices, spend 15 or 20 minutes, not more than that. So I have had to curb their enthusiasm for telling the entire history of the project with extensive slides. But it's to take 15 to 20 minutes and just give staff and provider an overview of a picture of lead, home visiting services, the P1, the Healthy Homes for Healthy Kids program, and to try to increase awareness of that program in the primary care community. We're going to work with our Medicaid colleagues and MDE to try to think about how we identify those providers who might potentially benefit from such a visit. And I think, Barbara Moore, I'm calling you out. I wonder if we could use a couple of our healthcare providers as test subjects to try to test this and see how it goes. So, Barbara, if you're willing, I might ask you to volunteer.
Okay.
To be
And if they would like to come over on a Tuesday and see how our clinic runs.
I would love to do that. So if only somebody on this call were from the Baltimore City Health Department somewhere and could touch base with Rebecca Deneen and me about Dr. Asenso, if only we had somebody from the Baltimore City Health Department here.
I think we have the deputy chief of staff. She's hiding.
You thought I was going to let you go after your transition, really?
Please let me know what you need from Rebecca and I. We'll make it happen.
Yeah. So Dr. Asenso is rotating with Rebecca now, and I think it would be great to have him visit the Mount Washington Pediatric Hospital as a test case for this. So that's another thing. I think we are very excited about MDE's transition to the Healthy Homes Lead Poisoning Surveillance System. I'm looking forward to working with Fred, Shanika, and the group. And I think we want to have a discussion with them about the strategy for how the local health departments are going to become engaged in this. We're trying to figure out how not to burden the local health department case managers, but also improve our ability to look at case management notes and other data that will be important for both MDE and the health departments to understand better how to do that case management function. Those are some of the highlights. I think that for us, not just a focus on lead poisoning prevention week, but also on making sure moving forward that we integrate as much as possible all the improvements in data sharing with the commission and with the stakeholders in lead.
Yeah, day to day, as I said. Thank you, Cliff. Wendy, who's up next? Dr. Rogers is not on, but I will say that Chevelle and I, amongst others, attended the annual meeting of the AAP and was continuing those good partnerships. Really appreciate Dr. Rogers and the work there, and we will try to engage them where we can on Lead Week. Office of Child Care.
Mangela, are you there?
Yes, I'm here.
Okay.
Thank you, Dr. Mitchell and the MDE, MDH team for updating the late form. I have been presenting it to the licensing specialists and also various childcare providers in the information sessions. And I was surprised to hear from the licensing specialists that the violation or the citations that the licensing office provide to the childcare providers are for the late form, because these providers are burdened to send these children at 12 months and 24 months to ensure that they are being tested. And it's not the resistance from the parents, but it's the inconveniences that they face during the critical months of their age, from 12 months to 14 or from 18 to 24 months. Sometimes tests being done earlier, or once the child goes later after the sick visits, then it's not being done. So it's a lot of back and forth, but I really appreciate my licensing staff to be on the providers, and the providers, though they get the citations, and these citations are made available to the public and to the parents to know how many citations these providers receive. And that becomes the determining factor for the new parents to enroll the children, because they don't want to enroll the child into the program that had many violations. But we are working through. The form is simple now. It's clear, it's clean. And I'm happy to see that questionnaire is added on the first page itself. So it's working, and I think we will be able to get many children to be screened at this early ages. So that's an update from Office of Child Care. Thank you.
Thank you, ma'am. And Mangela, do we keep statistics on how many certificates, like the percentage of compliance on lead certificates for pre-K, K, and first grade? I know that's probably not your area so much. And Cliff, I guess I'd ask you in the Department of Education if we keep any tracking of that.
We do not maintain a separate the violations for each item. It comes under health and safety, but there are many factors that they are being cited for. Majority is
that's a separate issue, but that's good. I'd love to sit with you and understand how you do that. But Cliff, do you know if we track the compliance with the school disclosure? Thank you, Mangela, and congratulations again.
Yes, I know. I know with 100% certainty that we have no idea what compliance with the school disclosures is. It's the only thing I'm really confident about in this world. That, and I know where I can find Camille. Those are the only two things that I know.
Yeah, I'm
of.
just wondering the benefit of, those kinds of things that we don't have a standard by which we track.
Yeah.
And it's, and the benefit of having put a legislature through that, and then Jim Hubbard's great honor, right? I mean,
Yep.
he was such a good man. But I would like to really address that somehow, even if it's just education to the education system on this, and get some feel for that. So,
comment about that.
Mhm.
So I think just remembering what the purpose of that was to begin with, which was to make sure kids got tested for lead, and really to serve as both an incentive and a little bit of a club, in the sense of making sure that parents were asked about lead testing. The legislature never built any penalties in there other than enrollment, and in reality, that's never been a complete deterrent, and really only in childcare is it really much of a deterrent, I think, because effectively, I believe, without having any data, that in most cases, kids enroll in schools without the forms. They probably have something like, I forgot my form, I'll get back to you, and it probably goes the way of many things in reality. Daycares, I think childcare is different because the regulatory framework is much tighter. I think the question for us to ask, Ruth Ann, and I think, Madam Chair, I think it's a good question, is that form the most effective way of achieving this end?
Yeah, right. I think we have to value all of this and figure that out.
I think the commission, that is a great question for the commission. And I think it's a really important and valuable question.
Yeah. I just, we need to put our efforts on the highest push points, given limited
I absolutely
limited bandwidth on that people have, to not lose the importance of this. I mean, I'm up every night. Having kids with 60s, 70s, 80s, 90 lead levels.
Agreed.
Makes it sleepless nights of, if we're successful, that's not the version of success. And what's the rethink in 2023 of how do we go about this differently or better?
And I totally share your thoughts about that. And I think it's a great question to ask. And it would be, the question really is, how do we most effectively identify those children and make sure that they're tested?
Well, and have there are predictor models, and Dr. I see you, but there are predictor models that have been really brought up in various places, right? And our team has written one that's been used by states. There's a couple of kind of good analytics groups who have done some predictor models, and we just have to figure out what's going to get us to the highest level of prevention. And I have some thoughts on that for sure. Dr. Boss Victoria?
Yes, my question for clarification. The certificates that for the lead testing that is being submitted to schools are not being included in the child's registration record. I mean, to give the forms and to say that we're bypassing, or that there's a roundabout, that they don't have to have the form in order for their child to be registered in a daycare or any other school-based setting. As I'm communicating with school-based clinics, that, in fact, in the past 2 weeks, I've had 13 to register, and that is a requirement. So I guess I'm just trying to make sure that I have clarity as I communicate with new sites that are now being funded in order to increase blood lead testing in communities and community, a variety of diversified, let's say, place-based settings. And they're screening children using lead care and submitting their reports. So if that certificate is not one of what we're saying they must have in order for their children to be admitted to any one of these facilities, schools or daycare or foster care or anywhere else, what are we saying?
So,
I
Dr.
just need
Boss
clarity
Victoria,
so I can communicate.
yeah, Dr. Boss Victoria, I do want to be clear. Right now, the law of the land and regulation is that parents have to have that certificate, and we are not changing that. But I think that the question that I believe the chair was asking, which I think is a good question, is as we ponder hypothetically the future, what in the future is the most effective way of achieving that goal of making sure that kids are screened for lead? And that is, if I was wrong about that, Madam Chair, I apologize.
No, you're spot on. And I think this is something that's not going to get resolved today, but is at least getting raised up to how do we structure a response and answer something that we can try to do within our bandwidth. But you know, what's actionable here in an administration, and Christine, I'm coming to you, in an administration committed to equity, environmental justice, and prevention. I want to make sure we're doing all the best things we can do to meet that. Dana?
I think Cliff answered. I've just in childcare, private childcare settings before the age of 5, children have to, according to COMAR, the parent has to take them and get the blood levels done, and we can get a non-compliance, and the child will not be allowed in without the testing. So it is very much inspected in our world. I can't speak for the public school system.
Well, I want to say thank you for having that standard, and thank you for having that expectation and working to that, because I think it's important too. If we have stuff, we have to have standards by which we uphold it, educate, incentivize it. Thank you so much, and I appreciate that. Wendy, where are we on the next piece? And then for those who just had that discussion, I will consult offline on what we can do actionably. I think we are. Do we
Anita Cooper, I don't believe is online. She was earlier, but she must have had to step
Yeah,
out.
she had a note that she had to step out, I think.
Okay. And then Jack Daniels.
Come on, Jack.
I'm jumping in here. So as Dr. Mitchell had previously mentioned during their agency update, was just that we are working closely with his team, Candace and Medicaid, to work on sort of looking at our program one, Healthy Homes for Healthy Kids, pretty much at a good time for sort of evolvement to be able to create better outreach, but more application volume, pique more interest so that we can end up doing what we do best, which is the facilitation of the abatement and other functions. So we're working closely on them. We've already had a couple meetings, and we're continuously diving in to see if we can have actionable items so that we can get enrollment up and our services out there from a DHCD standpoint. We are closely working with the family that was brought up last meeting. We did officially receive their application, and there is a coordination for our team to go out to the property to finalize the scope of work so that we can move that forward tomorrow in the afternoon. We've been reaching and coordinating. We just haven't got the actual time and the confirmation. So we're moving diligently and quickly on that so that we could assist that family and move it forward. We're also in the mix of finalizing MOUs with a couple of our local weatherization agencies that will commit $4 million to address critical repairs that are currently not being able to have work completed for because of those repairs on our energy projects. It's going back to our model of trying to do as much as we can, both from a critical repair standpoint, and all that includes as well as lowering utility bills and making homes more energy efficient as well as healthier for livability.
And Jack, are these all publicly bidded, awarded contractors?
Correct.
Okay, because the original contractors on the lead chip were sort of chosen by the department, not publicly bidded for that role. In the
Well, they
future,
they weren't. So when we originally started the program, we did not have the RFP in place through a competitive solicitation proposal. It was still on the onus of the client after being enrolled and identify that there was lead for them to reach out. We tended to find early on that they needed additional help just because they didn't know kind of where to start with. So we were providing them with a list of contractors who had worked and done lead abatement through the state, and then they were reaching out to them. Eventually, we did get send the proposal out for the RFP to identify and award contracts to them based upon the RFP that went out on them. So that's just clarification.
that would be great. Jack, I just put a note. If you can share that list of contractors, I'd love to see that. Making sure we have a really wide and broad and transparent way, and I'm sure you're working on that. And you should hear relatively soon on your HUD application, I think, right?
We actually just we recently just found out that we did not unfortunately awarded. So I did reach out to them for a debriefing to see where the scoring piece of it and where we can increase better. There is, I apologize. It was written down here and I hadn't gotten to it just yet, but there are 2 additional NOFA opportunities that we're working with as a part of the task force that has been completed. One is on older adult home modification grant program. That application is due the 16th of October, so we're working diligently on that. And then the second one is for the Green Homes Production Grant NOFA, which is due November 7th, and we're currently working on that with a team to submit our application. So I'm just trying to think if that's all of my notes currently right now. Yes.
Okay. Great. Any questions for DHCD? And then I noticed we don't have the city housing department on the line. So did Catherine ever show up for that?
Yeah, I don't see her on.
Okay. Camille, do you have any updates? I know Camille, is there somebody who's going to be doing lead on a day-to-day basis, or do you have dual job?
I have dual jobs right now. Recognizing everything that we've been talking about kids not getting to school, not being tested, Baltimore City has completely shifted its testing strategy to include not only immunizations. We are reaching out to St. Vincent de Paul Head Start. We're doing our testing tour again. They got another 300 or 400 new kids enrolled. So we're going from site to site. And because St. Vincent de Paul is apparently spread the word, we're now entering a relationship with the Y Head Start. And it looks like we're going to be doing a tour of Head Starts, which is fine because those kids are 3 to 5. So we're doing our best to get those kids, but we'll give you more details once we kind of set up some dates. But we're always going to be at immunizations, but St. Vincent de Paul has asked us to come back every single year. So Head Start may be another place to kind of focus your efforts as well. And I certainly am happy to share details.
And please let us know collectively what you need in support for that. I'm huge believers in Head Start work. Okay, and then I think we've done the outreach piece from GHHI. The only thing I will add, Barbara, yes, ma'am.
Right. Since we are increasing at Head Starts, which is fantastic, just something to keep in mind for those 5-year-olds. Pretty much services are not available once they turn 6. which is as they're entering either during kindergarten or as they're entering first grade. So if we can, I don't know, facilitate getting things done quicker as we see their 6th birthday approaching, that would be fantastic.
What do you mean by services? Because P1 and P2 serve kids up to 19.
They do, but
So-
other services, a lot of them are not available. It's harder to get, and
okay,
a lot of encouragement.
Great. Again, looking at all of these issues that we've talked about, a couple of things I want to just raise. We have been working as an organization to advance the Lead Safe Kids Act, which is being introduced into the Senate and into Congress. Not sure what's going to get out of Congress in the next piece, but which is to improve standards in public housing. And I do want to thank the Baltimore City Housing Authority for their promptness in helping with the recent spate of cases, and to ensure that we have a level application of standards of lead safety. We also submitted comments, as I'm sure MDE and others did, on the EPA's proposal to lower the dust lead standards, which will make things a little more stringent on contractors, property owners, and agencies. So we're going to be doing a lot of training around that piece to ensure that work. And I don't know, I can at Wes, if there's anything else you want to add. There's a number of comments going in around climate work, as I said earlier, that is looking at the connection on lead. And we're trying to do a number of public engagements around the connection around toxins and lead. And I did share, I think, with the commission some advancements in enforcements that are being made around the country. Maryland law continues to get replicated in places. The state of Rhode Island just replicated the Maryland law, basically across the board. And there are cities around the country looking to Maryland for standards on enforcement. And I'm sure Chris and others get contacted around this. Wes, if you're on, do you have anything to add? I'm not sure if he's still on.
Nothing additional, but a possible future agenda item is MDE did release the lead and water funding for the different jurisdictions. So that may be something to update the commission on.
Okay. Well, we'll look to add that, Wendy. And then other comments from other commissioners or the public. All right, we will, next meeting, we will, Wendy and I will work to get an advanced agenda out. There's a number of things that were raised here. There's a number of reports that are coming out that may be of interest as well. And we appreciate that. I want to congratulate the public servants that we raised up this morning. It is a thankless job to be working in state and local agencies often, and I know there's a lot of exhaustion, a lot of dual roles, and a lot of things that have to happen there. So thank you so much for that, and appreciate Wendy, as always, for being the backbone of support here. And we'll work together on the appointments list. And thank you all. And we'll give you back 23 minutes of your day. Please, I encourage you, please participate, engage, and share for Lead Awareness Week. We are not done with this thing, and we need to be done with it. So as we advance equity, as we advance environmental justice, and as we advance better health for our kids and our families, please demonstrably engage in this awareness campaign as we lift that back up. Thank you so much to everybody who participated today. And please, if you have comments for the commission, suggestions for the commission, or input, please contact Wendy Phillips or me, and or me, I am not sure if I got the grammar straight. And lastly, go Orioles, beat the Rangers.